Hello, my name is Tracey Williamson and I'm the Dementia Carers Count Professor of Family Care in Dementia. My appointment is half funded by the charity Dementia Carers Count, although I'm based at the University of Worcester in the Association for Dementia Studies. So in this partnership, my role is around developing a research programme specifically focused on family carers of persons living with dementia. What I've been doing in the first year or so of the post is to develop a research plan. So you can imagine that I've wanted to do this in a very authentic way, and along the way I've been speaking to people such as family carers and people that work at Dementia Carers Count and wider communities to ask what they think are priorities for research for family carers. So in terms of the research plan that has evolved over the last year, this is focusing specifically on the experiences, needs, interventions and outcomes for family carers. So what that means is asking family carers through research about what their experiences are day to day of living with or supporting, having a family member or a friend with dementia, seeing what their needs are that arise from those experiences. Interventions are things such as activities that we can do or that people or services do to support them or that they can do to support themselves. And then the outcomes is around what difference do those things make to them. Do they have an impact? Do they work? And if they do, for who, in what circumstances and why? And through research we can learn much more about what it's like to be a family carer of a person living with dementia and hopefully make their lives better. So the way that the research plan is evolving is myself doing an exercise to find out people's priorities for family care research. And we've done that through a listening event, getting lots of members of the community together, such as family carers and others, to ask their views about the priorities for research. But it's also looking at funding streams, so we might have ideas for research, but we need to find some money to actually undertake the studies. So it's looking at funders who are supportive of research into family care, and then perhaps working up some of our ideas and submitting applications for funding to try and get those studies underway. So that's quite a competitive process. Sometimes we work with external partners such as charities or organisations who might have a research idea, and they may work in partnership with us and develop a programme of work which they may fully or part fund. Sometimes my role would be around not doing pure research per se, but doing project work with people such as consultancy or working with organisations or companies, for example developing technology that perhaps carers can use in their day-to-day lives. Other project work could be consultancy to advise family carers on how to make their homes more dementia friendly so they can better support the person they care for in the home environment. Also some of my activities being based in the university around developing future workers around dementia care. So I sometimes teach people like undergraduate nurses and other health and social care professionals to try and instill in them from an early point in their career to always think of family carers not just patients in their professional work. So the principles I work on very much are around authenticity and involving people early. So for me there's no point generating a research idea and an application for funding if I don't actually work with family carers from the earlier point as possible, really. And then if family carers then want to work with me through the actual research itself, perhaps as a co-applicant or as an advisor, or maybe even as a research participant taking part in some research like doing a survey or being interviewed, that's fine, but it is for me about seeing what people want to do about involvement and then trying to make that happen. So if anybody viewing this video would like to get involved with us, perhaps contribute to our funding or work with us in partnership, perhaps something to do with sponsoring PhD students, coming to some of our events or engagement activities, whatever the reason might be that you want to get in touch, please do through our website. If there's a research involvement opportunity, then I'll be in touch shortly, but for anything else, we'll come back to you as soon as we can. Thank you.